We can start.
Okay. Well, welcome to a training session that I'm holding today. My name's Lisa. We have Bibin as the learner and observed by Monica. Okay, first of all, we'll start. We're going to be talking today about patient visual observations that we do on the mental health unit here in the hospital. Before I start, should there be any alarms going or any fire or fire alarms, we need to follow policy, and I need to guide you out of the doorway here and follow the fire information and signs out to the safe area outside. Ground rules: if anyone's got their mobiles, please turn them on silent. If there's an emergency, let me know and we'll stop the session right now. And if you have any questions, and they're important, please feel free to interrupt me during the course, otherwise we'll go through questions and answers at the end of the session. Is that okay?
Yeah.
Cool. All right. So first of all, Bibin, what's your understanding of patient visual observations?
Yeah, we need to check the patient's mental state, what they're doing it, and document what is it exactly, and document where the location is.
That's correct.
Yeah.
Okay.
That's mainly.
That's right. Well, there's an actual, I got this off the Internet Queensland Health, I couldn't find our own WA Health. Therapeutic visual observations are an active process of observation and engagement with patients to benefit treatment, support, recovery and enhance safety. So that's all sort of explanation of why we do this. So when, why and how are visual observations undertaken? So based on risk assessment, visual observations are done at regular intervals, and you do them, don't you, how often do you do them?
Yeah, 15 minutes or 30 minutes or hourly.
Okay, and is that always maintained on the hour? And
Yeah.
Exactly on time?
Yeah.
Okay. All right. So visual observations are done by, we check the location of the patient, we check them for patient safety, we monitor their behaviour, and we give reassurance to the patient. That's why we do these visual observations.
Okay.
And they're not just in our hospital, they're done in all hospitals for all different reasons. So how are visual observations done? You're upskilling, so you do them at the moment.
Yeah.
So if you disagree or want to add anything to what I've got here, please feel free. Clinical staff walk amongst the patients, visual sightings of them on the unit, visual sightings in their room, observations of movement, actions and breathing patterns. It's important to maintain that when you go to a room and you see someone sleeping, that you just don't write down that they're sleeping, because they could be dead, they could be hurt. So ideally we need to make sure that we can see their hands and their face from the neck upwards. I personally would wake them up. If you wake them up, then that's your call, but honestly I think it's sometimes worth it, as long as you can see that they are breathing and that they've moved at least between one observation time and another. Observing differences in behaviour, that's another reason why we check them, in case they're not feeling well, in case they're anxious, in case you think that they're going to become disruptive or aggressive. Again, checking hands and head can be seen unobstructed under the sheets is a big one, because we all know that sometimes patients will be asleep, will think they're asleep and they're lying under the sheets and they've got a noose or they've got something that will harm themselves underneath the sheet. Okay, so we've discussed briefly the 3 types of visual observations. They're done 15 minutes, 30 minutes and hourly. I've written here 15 minutes, you can interject if you like. Moderate risk, low in mood, anxious, behavioural challenges, possible risk to self or others, and new to unit. They're the times that we do 15 minutes. 30 minutes, they're patients who have moderate to minimal risk, behaviour slightly stabilising, they might still have anxiety, possible risk to self or others. And then there's your hourly, and we try and get all patients on an hourly visual observations, and that's when they're okay. That's when you're not too overly worried about them, that you just want to make sure that they're okay, that they're happy, that we can see them, we know where they are, but they're at no risk at that stage. Of course, if you feel that they are a risk, then we can change. Right, can you name any limitations or considerations when performing visual obs? Anything you can think of that might make a visual observation difficult?
Time management sometimes.
That's one thing. Well done. Okay, I've got patient safety. Staff not to put themselves in danger. So that's a limitation. So when we're looking at some people for 15-minute visual observations especially, they're deemed to be quite dangerous or at risk, we don't just go bounding into their bedroom to see if they're okay. we have to make sure we either have someone with us or that we are prepared and we're at a distance safe just in case they're not happy. Again, patient mental state, similar to that. Some people are very, very paranoid. The last thing they want is someone staring at them. So we have to be mindful of the reason why they're here and how they are at that time. Limitations are also privacy, if they're, and gender, patient gender, we'll put those all together. A lot of ladies will object to, especially, this is all going on the fact that they might be in the bedroom. If they're out in the unit, then that's fine. We can just check them by visualising them and saying, hi, how are you? If they're in the room and you're a male, be aware of that. Knock on the door, don't enter the room. If they're in the bathroom, don't enter the bathroom, don't enter the room. See if there's a lady that will come with you or go in and do the work for you. Alright, just safeguard yourself at all times. Documentation. Now, I've got documentation here, you're familiar with it. There's two types of forms. There's the one form that we use for people who are being checked every 30 minutes or every 15 minutes. And as you know here, you need to put the times. You should put the actual time that you see them, not the quarter past, half past, quarter to, and on the hour. If you see them at 10 past, you need to put 10 past. These are legal documents. So if anything were to happen to a patient, it will go to court and you will be called, unfortunately, or whoever writes it will be called. So you have to make sure that the time is exact as to when you see them. You need to put where they're seen, how they are doing, whether they're awake or asleep, and you have to sign, alright? And we also have one here, category 3, which is for patients who we see hourly. Slightly different, not so full of information, and we've got all the codes there to write, depending on where you see your patient. These are what you carry with you at all times whenever you go and see visual observations. And if for any reason there's an issue or you don't see a patient, then you need to let your senior staff member know. Okay? And you always make sure that these are maintained all the time. Any breaks in it, legally, that's not acceptable, but also it can come back on us. We need to know where those patients are. Okay. So, conclusion. So we'll reflect on what we've learned. So you do them anyway. Are you happy with the visual observations that you do and the explanations that I've given you?
Yeah, I'm happy, yeah. I've got more information, more specific about what I'm doing at the moment, so I've got...
That's good. Great. Okay, so we've discussed the why, the what, the when, the how visual observations are performed. The practical assessment we'll just do now. And just closing off, finishing the session, next time, we'll talk about observation process if patients are not seen. Because there's always an occasion where you'll go out there to see someone and they're not there. And we all run around trying to find them. And we still can't find them. And it's a big hoo-ha. So then we have to find out what we do, who we report to, what forms we need, and immediately whether they're on a form or they're not on a form, mental form, as to who we tell. Alright? Okay, so we'll close off the video now. We'll turn it off again when we do your practical assessment.
Thank you.
Thank you.